Hi, it's Dr. Centeno, and this is how to rehab from CCI. This is the part 3 video. In the part 2 video, I focused on the different rehab interventions. This is now how to take those interventions and match them to your current functional level. And this is for mostly functional patients, and it's the deep dive video into that topic. Now I want you to like, comment, share, and subscribe, because if you chanced upon this video, you can pay it forward to another CCI patient by doing these things, because that makes it easier for other patients to find. So this is a 3-part series. I started out with threading the needle, which is really how to balance flare-ups with progress in rehab. And then we get into rehab strategies. Those are the different things you can do. And now this is taking those different things and matching those to your current functional level. And here we're talking about mostly functional patients. And these are patients who can do most things without symptoms, but they can't really exercise, or they limit exercise to manage their symptoms. Now, some CCI patients are much more disabled than this. We have a video for each of these up here. So if another classification matches your functional level better, then go to that video. And the goal here is to get you to the next functional level. So in this case, going from mostly functional to functional. And now we're going to dive into some of these concepts. So the first is climbing out of the hole, right? And what I mean by that is that if you're mostly functional or functional, rehab can be relatively short. But if you're bedbound or very limited, that's a deep hole to climb out of. It can take a long time and a lot of effort. Now, this is another representation of that first video, threading the needle. If you haven't seen that video, go back and watch it, because that's an important concept. But I'll give you another take at that same concept here. And that is, you start at your current level of functional disability, you try some rehab strategy, and if your symptoms are manageable, then you should be able to increase the difficulty of what you're doing. And then you should be able to get to the next functional level. But if things cause too much of an unmanageable flare-up, then you're going to have to dial back that rehab strategy and try again. And if it just won't work at all, meaning you can't move forward in all the things we're talking about here, then you're going to need some sort of intervention like a orthobiologics procedure, a posterior injection, or a PICL, etc. And obviously the goal, if your symptoms can remain manageable as you make things more difficult, is to get to that next functional level, in this case being fully functional without symptoms or very minimal symptoms. The first thing we're going to talk about is collar use here. A lot of patients who have CCI use collars. So at this point, you should be completely out of a cervical collar. Now, what if you can't get out of the cervical collar at all? Then you might need an intervention like a posterior injection or a PICL. And again, the goal here is to get back to exercise really without flaring your symptoms. So if we're talking about muscular instability, which is stability is half ligament and half muscles. So you have to build those muscles if you're going to get to the next level. Now, an easy way to do that and combine that with proprioception or position sense is to do our laser exercises, which I've talked a lot about in prior levels. And at this point, you should have progressed through those. If you've never tried them at all, go online, try those. You should be able to just bop right through those, or at least get to level 2 or 3 without much difficulty if you're at this functional level. Again, go very slow with those exercises, and if anything increases your symptoms that just makes your symptoms unmanageable, then stop. Now, what if you can't tolerate that type of thing at all? You can't really do any strengthening, even the low-level exercises we have online. Then you might need a posterior injection or a PICL. Now, if you can move through those exercises relatively quickly or get through them at some point, then you can move on to the next step. And that might be meeting with a physical therapist. We recommend the Institute of Physical Art. They do a great job at training their physical therapists to a very high level in spine. Now, let's say you don't have one near you or can't do that, then you can try to do some simple at-home neck strengthening like this Next Level device that you see here. So lots of different options to try to build strength. Now, when it comes to symptomatic structures, you may want to try AO or NUCA chiropractic. And the reason for doing that is that those very specific low force chiropractors can help align C1, C2 better, which can take pressure off of those structures, things like your neck, irritated nerves, vessels, etc. And that's really what this level is all about. It's about realizing that you have structures in your neck that are causing the symptoms. The instability is the root cause, but these structures are what cause you to be miserable. So for example, upper neck facet joints can cause headache. Irritated occipital nerves can cause headache. So on that note, many patients can get relief by just doing self-massage at the back of the skull. Now for some patients, that'll cause more occipital nerve irritation. So for those patients, do things like consider ice, for example. And icing back here can really help to reduce pain if pressure back there is painful. Other patients, they'll love getting some pressure back there. You can also try self-massaging this area for pain relief. That includes using things like Theracanes, where you can get to other spots like in your upper traps, etc. So lots of different things to consider that are focused on finding those specific spots that are causing your symptoms. Then we go to curve. Now curve is a big problem in many CCI patients, neck curve, or what we call lordosis. And to see if you're ready for this, we use this towel test. So that is just take a little hand towel, roll it up, put it behind your neck, and lie face up on it to try to force a little neck curve in there. Now, if that feels good, then you can go to the next step and get a CBP provider like those that you can find at idealspine.com. Those are providers who use specialized traction to try to pull a neck curve back in. If you can't do that because there's no one near you, then you can try at-home devices like you see here on the upper right. Now, if any of this increases symptoms, however, then stop. If you can't tolerate this at all, then stop. And you may need an intervention like a posterior injection or a PICL. Posture is another big component. And at this level, you should be able to do things like try some of the online exercises through Healthy Posture Club or a GOSCU. And these are guided through a therapist. Now, if you're already working with a therapist through IPA, then you may not need this at all. If you can't find someone like that, then this is a good entry point to start your at-home physical therapy. Now, if you can't tolerate any of this, then just stop. And again, you may need an intervention like a posterior injection or a PICL. So in summary, if you're mostly functional due to CCI, there are things that can help. Many patients can get fully functional by just doing some of these things, focusing on posture, strength, curve, etc. But other patients may not be able to. So if anything makes you worse, then you've got to stop. And if you can't advance in anything we're talking about here, that's when orthobiologic interventions can come in. So again, before I let you go, like, comment, share, subscribe, because that's how we get this information out to more patients like you. Thanks so much for watching, and have a great day.